Good evening. Today is the 28th day of December 2015, and I'm here with our dear friend, Dr. Pachegaonkar. The subject today is a very important one: the role of homeopathy in today's world, with special reference to diabetes. Welcome, Dr. Pachegaonkar. Please tell us about your research and results in treating patients with diabetes, and what is the role of homeopathy today?
See, in this modern age, the real understanding of health has changed so much. Earlier, health means just a prolonging survival or eradication of physical ailments. But now, the understanding of health has been modified. In the sense now, the physical, vital, mental, and spiritual balance. If all the four aspects of the being are in harmony, then only the person is supposed to be healthy. So, with this understanding, if we go, homeopathy has the best scope in dealing with each aspect of the individual. And in modern world also, people relieving pain, then prolonging life, these are the palliative techniques which are definitely helpful in making the person survive further.
Of allopathy.
Allopathy, conventional system,
Yes,
that's what I
conventional.
say. But homeopathy has been, he was a very popular allopathic practitioner in Germany. And when he was disillusioned by the results, that it is only mere palliation, person comes to us for some complaint that is removed, then the person comes back again with something else in some other form, but which is more grave. So that he just abandoned his practice by getting disillusioned by the results. And he stumbled upon the homeopathic principle while translating very popular pharmacopoeia book that was called as Cullen's Pharmacopoeia. And there he was working on treatment of malaria. And there he came across a statement that quinine cures malaria because it is bitter. Then somehow he was not convinced because what that bitterness has to do. So what he did, he himself consumed quinine. And when he consumed quinine, to his surprise, he developed signs and symptoms of malaria in himself. Then he wanted to ascertain. Then he realized that this is the property of this drug. And he administered quinine in other healthy people around, and he found out that everyone invariably produced signs and symptoms of malaria. And malaria, this drug was known to cure malaria, but people did not know how it cures.
Oh.
And now he realized that because it has a property of producing such disease in human beings, it can cure natural form of malaria. So this way he started experimenting with even other drugs. So all homeopathic medicines are proved in this way on healthy human beings. Otherwise, generally conventional system believes in proving medicines either on rats or guinea pig, lower animals, and then they study. Another aspect of homeopathy is that the medicines of homeopathy, the dosage especially, are monitored depending upon the sensitivity of the individual. They are not on the basis of body weight. The doses and the potency and repetition is based on the susceptibility, sensitivity judged in that particular patient, which is not the case with conventional system. Now we see that even if the same body weight is there, the dietetic intake of the person would vary, the requirement would vary, it will not be same depending upon his individuality. But in conventional system, all the medicines are given on the basis of body weight. In homeopathy, we judge the susceptibility, sensitivity of the individual and then plan the doses.
And what about age?
Yes, age is one of the criteria to judge the sensitivity.
Okay.
Age also helps, but like depending upon the age, the susceptibility goes down. The susceptibility is very good in growing age, like children, especially children.
Susceptibility means the ability to
React.
React. Okay.
Ability to react.
Okay.
See, like susceptibility depends on how you use the word. Like
Yes.
if the
Yes, of course.
if the person is exposed to certain bacterial invasion and the person catches it easily, we call it susceptible, isn't it?
Right.
So it is again ability to react
Negatively or positively.
negatively or positive.
Okay.
And sometimes we feel that all these reactions to the stimulus like bacterial invasion or viral, they are all the indicators of defensive phenomena. See, if the infection comes, our body has a system to react to it, to eradicate it, and body reacts to it, and the defense becomes active, and as a result of that, the person may have fever, pain, discomfort, and so many symptoms.
Yes.
Actually, in homeopathy, what happens? We try to work out the susceptibility level of each person at individual level and at that moment. And on that basis, on that phase, we work out the remedy. So this is the basic difference in orthodox system, that is allopathy and homeopathy.
But this seems to me to presume that the homeopath must have a deep inner connection with the other person, with the patient. Because without that, it would be mental only.
Oh yes. See, it is not like a format being tick marked by the patient. Like at physical level, patient has this. And
Right.
then we actually are trained to read between the lines. Homeopath has to be trained to read between the lines and work out exactly the disposition of the person. It is not like only mental state, but disposition of the person. So we don't ask person whether you talk more or not. Like loquacity. So we don't ask whether you are loquacious or what, you are timid or what. We don't ask that. We generally go for the actual life situations the person has faced and how he has reacted in those life situations, and on that basis we try to work out his remedy.
So that is taking into account the past history of the patient.
Yes. What happens, like if for example, if you ask someone that someone insults you, how do you react? Now it becomes a hypothetical question, answer.
Sure.
That why should one bother if someone insults? Like that, some hypothetical answer we would get. Same way, like if you ask, like you lose some 100 rupees note, how do you react? Then person will say, oh, why it is not important, or like that. So some hypothetical answers we'll get. So what we ask is, what life situations person has confronted. Like if we ask, like, have you appeared some examination in life. So, have you passed every time? Did you fail? Then, what has been your reaction at that moment? Then, before going for your final examination, how was your mental state? Like
So,
you were excited about it, or you were nervous, or it. Then, how did you go through?
but this is more on a psychological level. Now, what about a physical level? Persons' past diseases, injuries?
Yes, yes. Actually, in homeopathy, what we do is we demarcate like the present disorders, the presenting symptoms, and the past history of illnesses.
Okay.
So what we do is the in present illnesses we take the whole totality of each symptom. The totality means the location of the complaint in the body, in that even directions, like suppose left sided headache, so it begins on the forehead, extends to the parietal area, goes to the occiput, then sometimes it shifts to the left side, it shifts or it may extend, it is a linear pain or diffused all over. Then we take the modalities, like how it is initiated, how it is triggered on, then how it is aggravated and how it is ameliorated. So ameliorating and aggravating modalities, and then sometimes even concomitants. Concomitants in the sense like associated symptoms, like with headache he has nausea,
Right.
or he sweats with the headache or not. These are the actually details we take about each complaint, and sometimes there is interrelationship between the complaints. So suppose person has 4-5 complaints, maybe they are interrelated. Like if he has loose motion, he may not get headache. If he has constipation, he may get headache. Something like that. So we take all the symptoms in chronological order at physical level in the present state. Then we start taking history of past illnesses. In past illnesses also, we try to work out totality at that moment. So we come to know how the health profile has evolved, and not only his past history but even family illnesses, like his parents, his siblings, then grandparents, what all illnesses they have, and that genetical load also we work out, and on the basis of that we work out a remedy which has all these characters.
So, heredity plays a big part or not a big part?
Pardon?
Does heredity play a big
Yes,
part?
definitely,
I
definitely. See, we call them miasms. Miasms, in the sense, these are the deep rooted undercurrents of disease producing tendencies. So we have like 3 types of miasms in each individual, and depending upon the inheritance and the acquired miasms, both inherited and acquired, we work out the remedy which matches at that level. And therefore we even deal with these undercurrents, we call them blocks, actually the obstacles, because if we work out a remedy on the basis of present totality and give the remedy, the person is relieved, but again the person comes down with something else in different form, but which we as a result of these undercurrents flowing in him. So these are basic miasms which are the real causes of disorders.
So, we have the physical and the mental, psychological, you mentioned spiritual.
Yes, yes, actually.
Please.
See, in homeopathy, we believe that the highest goal of each person is to become better and better and better person, and finally at par with the divine or one with the divine.
I see.
And in this journey, if a physician is going to help the person to maintain the health equilibrium, the progress of the person will be much better. So when we actually work out the case during follow-up, especially this helps us, that as a person how his health is projecting. A very simple example, if someone comes to you that I am nervous, so can you treat my nervousness? Then if we ask in details, that person will tell, okay, my job is to deceive people, and while deceiving the person, sometimes I go nervous while lying. So if with such quality or some symptom person comes, now are you going to treat the person to get rid of that nervousness while cheating the person or what? So what we do is we take out the totality that basically he has this passion that he doesn't mind cheating people or lying or stealing things. And in that he is getting nervous means definitely there is some part of him which is inhibiting him. So we take this totality and give homeopathic remedy, so later on he will not think of doing something wrong. And naturally there is no question of getting nervous either. So that way we always assess that as a personality how the person has improved in human qualities. That is our follow-up criteria actually.
And follow-up, I imagine, is very important here.
Yes, like mainly what happens in see, patient doesn't come to us informing that I'm finding difficulty in progressing as a better and better person. He comes to us for some physical complaint like headache, hyperacidity, like colitis or arthritis or some complaint, and that we utilize as an entry point.
As an entry point.
Entry point in the sense like when do you get anxiety, when do you get acidity, when do you get arthritis, how was your mental state when you started getting it. Through that we try to judge his personality, and on the basis of that we try to work out a remedy.
But are people that conscious of their psychological state when they got an illness?
See, whether they are conscious or not is not a problem to be solved. They suppose at some mental state the person has suffered a psychological trauma, emotional trauma. The complaints get somatized. The person may not be aware of it. The complaints get somatized on his body. So sometimes person may not be aware of it. He may not be able to correlate it, that he had this complaint and like emotional shock, and therefore he got it. He may not be able to correlate it. Okay. But chronologically we try to do it. We try to work out in that sequence.
Okay. Now let's get into diabetes.
See, what has happened, I have been in homeopathic practice for last 38 years.
38 years?
38 years.
I see.
So earlier we used to say that like if people have come with a diabetes, we used to say that diabetes, we can't tackle. You just carry on with your local conventional medicine to control the diabetes. And hypertension as well.
Hypertension as well.
Hypertension as well.
Okay.
So what happened, coincidentally, we had few cases, they were diagnosed by us for having diabetes. So when we detected that the person is diabetic, means it was a like virgin case. Virgin case in the sense like it was not handled by conventional system or medicines were not given.
So there was no prior diagnosis?
No. So we diagnosed it. And in such cases, we started giving them homeopathic medicines on the basis of totality. And we found that there are wonderful results, in the sense their blood sugar level started coming to normal, like just within 2-3 months. Initially we thought that it must be like stress diabetes or some drug induced diabetes. There were cases, where the diabetes was like all drug induced. The person was on treatment for his eczema, and steroids were being given, and eventually he landed up in diabetic situation. So in such cases, it was okay that it was a drug-induced iatrogenic diabetes. But we had really some genuine diabetic cases where they had a family trait. So many people in the family diabetic, and but they were not on either insulin or oral hypoglycemic agents, especially type 2 diabetes.
Mainly, you counsel diet and exercise, or
Yes, what we do is,
along with the homeopathic
see, the main
treatment?
reason for present state is they are physically not active. They have enormous mental stress. They are mentally active, but physically they are not active. They hardly walk. They don't work properly. Especially in India, we have seen that we hardly find people who do not have diabetes now after 35. 35. Can you
Who do
imagine?
not? You mean
Find
most have it after
most
30?
of the people we have noted that they have diabetes, especially in South India like Tamil Nadu. Very difficult to find out people who do not have diabetic trend.
Why do you feel, especially in Tamil Nadu? Because of lack of
Of
exercise?
course, we have been working here. That's
Yeah,
why.
sure.
Here, what has happened? Like physical activity, the regimen, the diet, they are not punctual. They are not physically active. They don't care for exercise. They don't sleep properly. They are a bit emotional type also. Plus, there are even other genetical factors also. In Tamil Nadu, there is a socially recognized marriage system where they marry their cousins. The marriages, consanguineous marriages within
Okay.
the family are very common in South India.
I see.
That also can be the reason.
Certainly.
So here what we do is we try to work out remedy from childhood and try to give him the medicine on constitutional basis, plus we try to modify the lifestyle. The first thing we advise is regularity in diet, like breakfast, lunch, dinner, three divisions, and then supplements of juice or some snacks in between. So divided doses of food intake, regular intake, and sleep timings, plus moderate exercise. We train them in moderate yoga asana or surya namaskar, like simple exercises, simple deep breathing pranayam like exercises, plus homeopathic medicines. And they are responding wonderfully well, even in hypertension also.
Oh.
Even in hypertension, of course we don't take risk there. What we do is, initially when we have detected the person to be diabetic, first few months we take weekly readings, their fasting and postprandial blood sugar,
Oh.
and we just see the trend.
Is postprandial very important? Or is fasting the most important?
Fasting is most important for management.
Or management?
For
Okay.
management. Postprandial also is important for the certain aspects of management. See, we take even urine sugar also. Urine sugar also is important because that gives us the idea of we can't even ampute from thigh in this state. So they said, no, we can't do anything. It was a dead end. And they were taking this lady to her own house from hospital, from ICU, that now she has to count last few weeks.
How old was she?
Because of she was in Maharashtra, near
How
Sholapur.
old?
She was 76.
Oh, I see.
And the person who was driving the ambulance, he suggested that why don't you try homeopathy? And she was brought to our clinic with that pain and all that, with color Doppler study reports, and we started giving her homeopathic medicines on the basis of totality. Can you imagine? We repeated even color Doppler study of the arteries. The arterial flow improved, the collateral circulation got developed, and her gangrene, it was a wet gangrene which became completely dry with line of demarcation. In gangrene, what happens when certain part of the body is dead, then body has a capacity to develop a line of demarcation.
Cutting it off.
Yes, that is what we call in surgical language line of demarcation,
Line
where
of
body
demarcation.
demarks.
Okay.
And that part is totally like mummified, and remaining part is quite safe. No antibiotics, no painkillers, and this lady developed a line of demarcation in the foot. Like terminal part of the arch was mummified. We have photographs. It will be interesting to see these slides. And color Doppler reports. And then once the line of demarcation was complete and the terminal part was mummified and dried, we asked, because that is beyond revival now, so we asked surgeon to ampute only that much part, and the lady could survive with only the terminal part of the arch of foot was amputated.
So once it's dead, it's dead.
Yeah, once
That
dead,
part, you cannot revive that.
But in wet gangrene, what happens that one part is dead means that actually provides infection. So whole body gets infected.
Okay.
So nowadays you just can't see a case in allopathic system where the line of demarcation is achieved.
Only through homeopathy.
Yes. Earlier in natural course it comes. But now people don't allow person to recover naturally. That is the problem. Too much of interventions.
I see.
That's why sometimes we call, see, in homeopathy, we always stimulate the innate healing potential of the individual. Homeopathic medicines are so minute that independently we don't deal with any organism or disease. Our homeopathic medicines can stimulate the innate potential in that individual to get rid of that disorder.
So, patient, heal thyself.
Yes. We just facilitate it.
I see. And what do you see with this tremendous increase in diabetes in the world? Because in America, of course, it's the fast foods and everything that are leading to so many problems.
See, in India, though, we don't have like proper statistics. Screening is not there. But in US also, like 10% population is diabetic.
10%?
10% population is diabetic now.
Is it, what onset, at what ages?
There, it is middle age where it starts.
Middle age, it starts.
Yes, middle age.
Okay. And is homeopathic medicine being sufficiently accepted in the West and in Europe?
It is, nowadays it is a bit difficult because in West what has happened, because of their so-called modernity and affluence, so many vested interests have entered.
Of course.
What happens?
Pharmaceuticals.
Not only
Well,
pharmaceutical,
not only that,
now
but of course,
even hospitals and a lot of
sure,
investments and insurance. Because not only that, the insurance companies have come, and it has become a nexus.
Yes, of
Actually,
course.
so it is difficult, and there what is happening? Anyway, people are taking homeopathy there. Now, in developed countries, homeopathy is more expensive than conventional. The reason being, for conventional system, you are insured.
True.
So
True.
insurance company pays. So it is almost free for even poor people, the best of allopathic treatment, because the government pays or other insurance companies pay, or the taxpayers pay for that.
Certainly.
But for homeopathy, one has to shell out $200 for consultation.
Oh, there's no
Pardon?
insurance for homeopathy?
No insurance for homeopathy, because what has happened? They say that this is placebo. The main criticism about homeopathy
really?
is that only
I see.
placebo is helping. I'll tell you one incident. Where I was practicing earlier before coming to Pondicherry, we had a local medical college, government medical college. And once the dean commented that because I was working in homeopathic municipal clinic, so he commented that, see, our 90% patients need only placebo. And therefore, homeopathy also has good results. Then I said, as a dean, you are speaking like this? Then he said, yes. Then I said, you just show me one instance in your medical college where you have given placebo to the patient. Then no, that means 90% people you are just feeding unnecessarily all rubbish medicine. If they don't require, why do you feed medicine to each patient who comes to you? And then the MLA who was monitoring the meeting started, what rubbish you are talking? That homeopathy is placebo and all that you are commenting, and you are telling in official capacity that 90% people are cured by just placebo.
Placebo.
So actually what happens, the way you to 100 people and see what happens. And if nothing happens, that means it is placebo.
They haven't done double-blind studies and...
No, see, even double-blind studies have a limitation.
Well, of course. And now they find that the
Yes.
the one who's conducting the study...
Yes. I'll give you one simple example. Now we have, suppose, some 100 cases, which are beyond doubt that they, like we worked on keloid. The keloid, so we have 105 cases under treatment. And they were classical keloid cases we treated under homeopathy, and 37 cases under allopathy. Different cases. In allopathy, not even one case got cured, and in homeopathy, 105 cases got cured.
Oh my gosh. Treating each one differently according to the person.
Yes. And nowhere in the world the keloids have regressed. Means at least they are not recorded to be regressed by any allopathic hospital.
I see.
We have patients whose keloids have totally regressed, which is unique. Now, what else is needed? What else is needed? Now, if someone asks, you just show us how it works.
But that's the difficulty, isn't it?
Yes.
How do you show that?
So what we do is, it works. It works. That is what we know. Now, maybe after some 100 years, people will be able to find out how it works. Isn't it?
Yes. Yes.
See, like we give always one example. that they always argue because of the quantity of homeopathic medicine, minuteness of homeopathic medicine. They always ridicule that one drop of medicine you put in one swimming tank and that becomes medicine. This is how they say. But see, the police people, they use sniffing dogs. Like suppose I leave
Good
my
point. Good point. Yes.
handkerchief
Yeah, and that dog.
and that dog sniffs. The dog will be able to locate me anywhere, if even if I am 3 kilometers or 4 kilometers away, dog will be able to locate me. You tell me how much quantity of my sweat or whatever comes through the osmosis in the atmosphere, and the dog is able to sniff it and recognize me or identify the criminal. Now, how much quantity can any machine show? How much quantity is in the air? The dog can, but the machine cannot.
Yes.
That means, see, the influence, the minutest influence. If you are susceptible, you are going to react to it. If you are not susceptible, you will not react. Now, if we choose a certain medicine for certain individual at that moment as a remedy, person will be susceptible to it. Whereas the other person will not be susceptible because it is not a fitting remedy for that person.
Are there cases where homeopathic does not work at all for some people?
Yes. Homeopathy has a limitation where, see, our main base of action is own vitality.
Is?
The person's own vitality.
Okay.
Now, if the person has lost the vitality, then our medicines cannot stimulate the cure. As I discussed earlier, our main target is stimulation of the innate potential in that individual. Now,
For healing.
For healing.
Right.
Now, if the person has lost the vitality, and even minimum vitality the person doesn't bear, then our medicines will not be able to stimulate it.
What can you do? Yes.
You can't do it.
Yes.
And that's exactly what happens in terminal illnesses like advanced cancers. So many conditions. Like there are some autoimmune disorders where already the disease is so advanced, you can't help it.
Even though the person may have vitality and
want to live
in
that sector. Vitality.
In that sector.
Yes.
Okay.
Yes.
Okay.
In that sector.
Yes.
Like deeper inside, through philosophy, we can say that deep inside the person's psychic being has decided to withdraw and all that.
Yeah. Okay.
But in that case, we really can't help. So there are people where they just lose the vitality and they don't respond. And it happens with terminal pathologies. Of course, there are cases of cancer where the pathology has reversed completely. They have lived as a normal person, no affections, even beyond 30 years.
Generally catching it early enough? Or
That
even in
also we
advanced
don't know.
stages? We
That
don't know.
also.
We don't know.
What happens, I'll tell you, the stage also is a very deceptive phenomenon. If the person has reached the second stage in 20 years, is one case.
Okay.
And where the person has reached second stage within 3 months, the pace of the disease is different.
Yes.
So much depends on that pace also.
Okay.
We have seen a third stage carcinoma case responding well and living better, whereas even the first stage carcinoma detected, the person gallopingly deteriorates. So each case is individual case.
And this has been really very enlightening. And thank you so much for coming.
Okay.